Hello everyone, welcome to another video on vitamins. So today we are going to discuss about various manifestation of vitamin B1 deficiency. So in the previous lecture, in the previous vitamin B1 video, I have discussed that if there is vitamin B1 deficiency, then there will be the Wernicke Encephalopathy, Korsakov Syndrome, Wernicke-Korsakoff Syndrome and Beriberi. In the Beriberi, we have dry beriberi and wet beriberi. So in this video, I am going to discuss about various manifestations of vitamin B1 deficiency in detail. Now first let us discuss about Wernicke encephalopathy. The Wernicke encephalopathy is acute, life-threatening neurologic condition. So in this Wernicke encephalopathy, there will be the classical triad of confusion, ophthalmoplegia and ataxia. So when you see a patient whom you suspect vitamin B1 deficiency, there is risk of vitamin B1 deficiency, like for example the patient give long history of chronic alcohol consumption and he has not been eating his nutrients as per recommendation, which leads to vitamin B1 deficiency, and there is the triad of confusion, ophthalmoplegia and ataxia, then you always suspect Wernicke encephalopathy because it is acute and life-threatening neurological condition. Now another condition is Korsakov Syndrome. The Korsakov Syndrome is another disorder that leads by vitamin B1 deficiency. Here what happened, it is an amnestic disorder that occurs due to chronic alcohol consumption. So whenever there will be chronic alcohol consumption, then there will be the vitamin B1 deficiency. It presents with confabulation, personality changes and memory loss. In the Korsakov syndrome, the memory loss is usually permanent. So it is not life-threatening, but it could be the debilitating condition. So another is Wernicke-Korsakoff Syndrome. In the Wernicke-Korsakoff Syndrome, what happens? There is damage to medial dorsal nucleus of thalamus and mammillary bodies. The presentation of Wernicke-Korsakoff Syndrome will be the combination of Wernicke encephalopathy and Korsakov Syndrome. So it will be both Wernicke encephalopathy and Korsakov Syndrome. It will be both acute, life-threatening, and it will be both amnestic disorder. Now let us move towards the beriberi. There are two types of beriberi that occurs due to vitamin B1 deficiency. One is dry beriberi, another is wet beriberi. In the dry beriberi, there will be the manifestation of polyneuropathy and symmetrical muscle wasting. In the vitamin B1 deficiency person, if we see polyneuropathy and symmetrical muscle wasting, then it is dry beriberi. And wet beriberi, what happens? Mainly the cardiac manifestations occurs. There will be the high output cardiac failure, usually dilated cardiomyopathy, and we see the edema. So in this video, we discuss about the various manifestations of vitamin B1 deficiency. I have described the brief about Wernicke encephalopathy, Korsakov syndrome, Wernicke-Korsakoff syndrome, and the beriberi. In the beriberi, I have described about dry beriberi and wet beriberi. So I hope you understood the lecture and you enjoyed this video. So we'll discuss more detail about various other vitamins in the subsequent lectures. Thank you.